This segment of Delmarva Life is brought to you by TidalHealth.
We often talk about the prevalence of heart and lung disease on Delmarva. In Wicomico County, 24% of the population is coping with some form of lung disease.
But pulmonary issues can be treated. In fact, TidalHealth's cardiovascular, pulmonary rehabilitation, and preventative cardiology is nationally certified, so you know you're in good hands. Dr. Ammar Alhaddad with TidalHealth Pulmonary joins us to talk about what TidalHealth has to offer. Ammar, how are you?
I'm doing well. How are you?
Thanks for joining us. Yeah.
So we mentioned national certifications. Those guidelines, I would have to assume, are pretty rigorous.
Yeah, they are. So to go through the certification process, we have to go certain modules, and every provider in that program has to go certain modules. And once we pass that certification, it actually gets renewed every 3 years to guarantee that any program that is certified actually meets the standards that are required by the certifications.
Oh, well, congratulations on that. So tell me about TidalHealth. What sets your program apart from others?
So actually, we started pretty early. The whole certification process started around 1985, and the whole organization started, and we started our program 1990 or 1991. So that's pretty early, and we've been doing this for now 20, 30 plus years. And our program is one of very few in the area, actually. The closest you'll find, it's probably Christiana and not anywhere else in the Delmarva Island.
Oh, wow.
Yeah.
Now, is it true that staff works with each patient to create a plan that's tailored specifically to their goals and their needs?
Yes, absolutely. So whenever the patient comes in, we call it orientation visits. So they tailor specific training program, nutritional program, they monitor their vitals, and they create that specific program for each individual patient, and they go through the program, and we make adjustment as we go if needed.
Yeah, yeah. And tell me about the patients you see. I mean, what are they presenting in order to see you? Have they already been through, I guess, an issue, or they're at risk?
So mostly we try to target patients that are at risk, because the whole idea of the program is to increase the capacity of the patients and prevent further hospitalization and deterioration. Most of them are lung and heart disease patients, the chronic lung disease like COPD, which unfortunately we see with smokers, interstitial lung disease, and lung fibrosis.
Okay.
So who is eligible to participate? Like, how do you sign up? Do you need a referral from your primary care?
So usually the referrals from primary care usually goes to regular physical therapy, but for specifically cardiopulmonary rehab, it's either usually the cardiologist or a pulmonologist.
Okay. So what do you deem a success when somebody goes through the program?
So that's actually a very objective measure. So when we do the orientation sessions, we have a questionnaire. So we check the quality of life, how far can the patient walk and do in terms of exercise. And by the end of the program, we measure these things again, and 90% of the time we see increase in all of these things.
That has to be rewarding to you as a doctor.
It is, absolutely. Seeing the patient that are hesitant to go through the program, because everyone thinks it's just a form of exercise, but it's really more, it's different than that. It's more tailored to lung patients, and having to hear that feedback and that objective measure improved is actually very, very rewarding.
And the quality of life.
Absolutely, yes.
Yeah.
Their quality of life improves, their hospitalization decreases, they actually even live longer.
That's wonderful.
That's amazing.
And we have that right here on Delmarva, thanks
incredible.
to TidalHealth. Doctor, thank you so much for joining us
Thank you very
this
much.
for having
afternoon,
me.
and thank you
Absolutely.
for all you do to help everyone.
Yeah.
Thank you.